Do you usually get medical checkups every year? Or maybe every 2 years? That routine exam you were so used to and considered part of your normal life might actually be having a negative impact on your well-being. Did you know that? Although it might be hard to believe, this isn't just a theory. It's something that is really happening, especially after the age of 70. Many medical tests that are supposed to provide a layer of protection can, in fact, reduce quality of life, cause unnecessary worry, lead to needless treatments, and become a financial burden. There's a reality you need to be aware of. According to a study by Harvard Medical School, 68% of people over the age of 70 undergo unnecessary medical tests, increasing the risk of misdiagnosis and inappropriate treatments. What's most alarming is that some tests beneficial for younger people can be harmful for older adults. The long-standing belief that more tests mean better health is actually a misconception that could put your well-being at risk. After hearing this story, you'll have a clearer idea which tests are worth doing and which ones you should firmly decline. You'll avoid wasting time and money on unnecessary exams and treatments, and instead be able to focus your energy on what truly matters, maintaining genuine health and well-being. Without a doubt, this can mark a deep transformation in your life during old age. Conscious wisdom will be a reliable companion in this second half of life, offering not only information, but real-life stories that can truly change your life. I'm convinced that today's story will also be a turning point for you. Relax and stay with me until the end. Last weekend, I took my 83-year-old father to a general hospital for his routine checkup. During the exam, some results came back slightly out of the normal range, so they suggested additional tests. However, after listening to the doctor, I realized those tests might not be very relevant considering his age. Cautiously, I asked, "Doctor, are all these tests really necessary?" He nodded silently and replied, "The usefulness of medical exams varies by age, so only the truly necessary ones should be done." That conversation led me to deep reflection. How many times have we undergone tests without questioning them, becoming anxious over the results, and even accepting unnecessary treatments? Did you know that, especially after age 70, the purpose of health checkups can change significantly? National medical guidelines often apply the same standards across all ages, even though it's obvious that a 40-year-old's physiological values can't be compared to those of an 80-year-old. Our parents often believe that the more tests, the better. But it's time to admit that this can be a serious mistake. Let me share the story of my friend Peter Kim. During a checkup at age 76, doctors found a small lump in his lungs. For 6 months, he underwent multiple tests and lived with constant uncertainty and stress. In the end, he was told there was nothing to worry about. He confided in me. During those 6 months, death was on my mind every day. And all of it happened for nothing. That's how harmful unnecessary tests can be, affecting the mind even before the body. It's crucial to learn how to identify which tests are truly essential and which ones we must firmly decline. Let this be the beginning of that learning process. The phrase medical exam has become routine in our lives. But do we really understand its deeper meaning? We think we're being cared for, but sometimes these tests can hurt both our bodies and our minds. Now is the time to rethink what we should truly prioritize in order to achieve genuine health. The second story I want to share today is just as impactful. Getting more tests doesn't always mean better health. In some cases, it can actually backfire. I experienced this up close through my aunt, who is 72 years old. She has always been very concerned about her well-being, getting annual checkups, and strictly following all medical advice, to the point of being considered a model patient. One day, during a routine blood test, a slightly abnormal result was found. The hospital recommended further testing, and my aunt, worried, began visiting several medical centers for more extensive exams. If this message is resonating with you, give a like and subscribe so we can continue walking this path toward a healthier, more balanced life together. Let's continue. Although no serious issue was eventually found, the whole process was extremely difficult. She underwent a biopsy that wasn't necessary, which led to an infection at the examined site. To fight the infection, she was prescribed strong antibiotics that disrupted her gut flora and caused serious digestive issues for over 6 months. When she told me, "The exams made me sick," I felt deeply saddened. In medicine, this phenomenon is called overdiagnosis and overtreatment, and it becomes more common with age. The explanation is simple. First, physiological parameters change over time. Aging is a natural process, and having values different from those of youth doesn't necessarily indicate illness. However, many medical standards are still based on younger bodies, which is not appropriate for older individuals. Some studies have shown that slightly elevated cholesterol levels in people over the age of 70 may be associated with a longer life expectancy. Are we, perhaps, labeling healthy individuals as patients by adhering to a standard of normality that doesn't always apply? Furthermore, medical tests themselves carry certain risks. For example, a colonoscopy involves dangers that increase with age. There is a greater likelihood of facing serious complications, such as intestinal perforation, and research shows that 80-year-olds are up to 4 times more at risk than those in their 40s. We must not underestimate the fact that tests that seem simple can have a significant impact on the body of an elderly person. The third aspect to consider is the side effects of medical treatments. After a medical checkup revealed that my mother's cholesterol was slightly above normal, she was prescribed statins. At first, she took them without question, but soon began experiencing muscle pain, making even the simplest movements uncomfortable. Later, we learned that, at her age, that cholesterol level was not actually concerning. Eventually, after stopping the medication, her body regained its sense of well-being. The next point is financial, an aspect we often overlook. Additional tests, medications, and frequent hospital visits represent a considerable cost. One of my friends ended up spending all the money she had saved over a year for a trip abroad on tests and treatments that weren't really necessary. What began as an effort to care for her health ended up taking time and joy from her life. Finally, the most essential and serious issue, mental stress, the anxiety while waiting for test results, the fear upon seeing any number outside the normal range, the constant tension from the possibility of being sick, all of this lowers the body's defenses and therefore impacts physical health. When the heart is affected, the body also weakens. This anxiety can turn into a discomfort more intense and harder to treat than any physical illness. So, which tests are truly essential after the age of 70? I'm not saying we should abandon all medical checkups, but rather that we should carefully choose only those that are genuinely necessary for our well-being and focus on health standards that suit our needs. If we can avoid wasting time on superfluous tests and channel that energy into improving our quality of life, we would be making smart health decisions in our later years. As we grow older, our bodies go through small but constant transformations. To face these changes wisely, it is essential to pay attention to our body signals and be alert to its needs. However, undergoing every possible test without discernment does not guarantee good health. What's crucial is to identify which tests are essential for us and to carry them out regularly. Below, I will mention 5 fundamental tests to maintain health in old age. First, blood pressure measurement. Hypertension can develop silently, without obvious signs, and suddenly trigger events such as heart attacks or strokes. For this reason, I measure my father's blood pressure every morning and record the results. At first, it seemed like a trivial habit, but today it has become a key part of starting the day. My father says, when I check my blood pressure in the morning and see the results, I already have an idea of how my body is doing, and that sets a tone for my day. Second, diabetes screening. Diabetes can cause various complications and significantly reduce quality of life in older age. Fortunately, if detected early, it can be managed through changes in daily habits without requiring medication. Our neighbor, Mr. Kim, was diagnosed with diabetes at age 75 and began walking 30 minutes every morning. In less than a year, he no longer needed medication, and his blood sugar levels returned to normal. He himself said, "Since I started walking, I've noticed better sleep, and my mood has also improved significantly. In fact, the diabetes diagnosis gave me a new outlook on life." Third, bone density evaluation. Particularly in women who have gone through menopause, the risk of developing osteoporosis increases significantly. When bones lose strength, even a small impact can cause fractures, leading to long periods of bed rest, or, in severe cases, becoming life-threatening. My mother was diagnosed with osteoporosis at age 67 and has since been regularly taking calcium and vitamin D supplements. At 78, she still walks with good posture and climbs stairs with ease. Her dedication has been the foundation of her excellent physical condition. Fourth, hearing and vision tests. It is common for the senses to be affected by aging. However, if this decline is not addressed, there is a risk of losing connection with one's surroundings, which could lead to loneliness, depression, and even cognitive issues. My uncle, though initially reluctant to use hearing aids, saying, "I'm fine, why complicate things?" began to show less interaction and seemed more withdrawn. However, once he started using hearing aids, his smile returned and his speech became fluent again. Fifth, screening for depression. Sadness in old age is often interpreted as a normal emotional adjustment to aging, but in many cases, it may actually be an undiagnosed depression. After my father passed away, my mother experienced severe insomnia and a notable lack of energy. At first, we believed it was just a normal part of aging, but when we had her screened for depression, the correct diagnosis was made, allowing her to start combined treatment with therapy. As a result, the light returned to her eyes. She herself said, "I never thought I was going through depression. I just thought it was part of getting old. But after receiving treatment, I felt like the world came alive again." These 5 tests are not solely intended to identify diseases. More importantly, they help us be better prepared to live more comfortably and satisfactorily in the second stage of life. It's not necessary to undergo all of them, but it is essential not to underestimate the key tests I mentioned. Medical checkups should not be treated as one size fits all. What truly matters is having a personalized plan that considers each person's physical condition, family history, and lifestyle habits. I still remember a phrase from Mr. Peter, whom I met many years ago when he was 78. "My parents died from heart problems, so I never skip heart checkups, but I no longer get tested for cancer. No one knows better than me what my body can still withstand." Like him, as we age, we must learn not to do more, but to choose more wisely. That is perhaps the true wisdom for maintaining our health. A key aspect is family. If a parent or sibling has suffered from a particular disease, it is essential to take seriously the tests related to that illness beyond regular checkups. In my case, because a family member had colon cancer, I undergo colonoscopies regularly. As for other types of cancer, after detailed discussions with my doctor, I decided to adjust the frequency of those tests. I came to the conclusion that it's not about taking every possible test, but about focusing time and energy on the conditions that truly pose a greater risk to me. When we talk about well-being, we can't ignore our daily habits. For example, if you've been a smoker for years, you shouldn't skip lung screenings. And if you spent long hours under the sun, it would be wise to get a skin check for possible cancers. My father, who was a carpenter for 4 decades, still gets regular lung exams. As he worked in dusty environments, the body remembers everything. One aspect we often overlook is the medication we're taking. Some drugs can affect liver or kidney function, making periodic monitoring necessary. My older sister has been taking arthritis medication for a long time, so she has liver tests every 6 months. Just as it's crucial to follow the treatment, it's also important to understand its effects on our body. No one knows our body better than we do. I believe it's essential to establish a relationship of trust with healthcare specialists. Every time I take my parents to the doctor, I prepare a list of questions in advance. Is this test really necessary? What risks might involve? Will the result affect the treatment? What could be the consequences of skipping this test at this age? Having these questions ready allows me to make informed decisions instead of being driven by fear. Most healthcare professionals are willing to provide all the necessary information to help us make more informed choices. Just as important as the medical test is organizing and keeping track of the results. I use a health notebook for my parents, where I record all test results, medications, and important notes. This has been extremely useful during medical appointments, since memory fades over time. Having everything well organized makes it easy to see which tests were done and what the results were. Today, I want to address a topic even more essential than medical checkups: daily routine. How do you spend your days? Sometimes, those small everyday habits can have a greater impact than the most thorough medical appointments. As hard as it may be to believe, studies have shown that after the age of 70, daily habits affect quality of life more than regular exams. I think of Grandpa Lee, who at 92 still walks 3 laps around the park every morning, rain or shine. He once told me, "Medication helps, but my legs are the best medicine." Since he started walking daily, he's barely needed to go to the hospital. Those words made me understand very clearly the huge importance of exercise, especially in old age. Of course, not everyone has the same ease of movement. If there are joint problems, low-impact activities like swimming or using a stationary bike are excellent options. For example, my mother was diagnosed with arthritis at 73, but she continued doing water exercises every morning. Finding a suitable way to stay active is essential for maintaining strong and safe health. At first, even the simple act of moving was scary. The uncertainty of when pain would strike made every movement intimidating. However, over time, she realized that inactivity only made the pain worse. As she gained confidence, the pain lessened and physical activity became part of her daily routine. The importance of habits becomes clearer with age. One example is the need to consume enough protein in old age. It's normal to experience muscle mass loss, and to maintain it, a proper protein intake is crucial. However, things get complicated. Teeth weaken, digestion becomes harder, and many older adults struggle to eat meat. My mother also stopped liking meat, so we opted for softer, easily digestible alternatives like tofu, eggs, and fish. We also added legumes as a plant-based protein option. I was surprised to discover how many tasty dishes can be made with tofu. Now, even without meat, she fully enjoys her meals. Staying well hydrated is just as important. As we age, the sensation of thirst decreases, increasing the risk of dehydration. That's why I set reminders for my father to drink water at regular intervals. At first, he found it annoying, but now he does it automatically, and his skin looks more hydrated, with fewer problems of constipation. Small actions, big results. Rest also plays a vital role in overall well-being. Many older adults face difficulties falling asleep, so establishing a consistent nighttime routine can make a significant difference. My mother, for example, drinks a glass of warm milk every night at 8 p.m., does some light stretching, and listens to calming music before going to bed. Being able to sleep without medication at her age is truly a gift, and she often says, "My nighttime routine is better than any remedy." Her words reflect both her hard battles with insomnia and her gratitude for the peace she now enjoys. Finally, let's not forget that we are social beings by nature. No matter how hard we try to stay physically healthy, if we isolate ourselves, both the heart and body will suffer. Numerous studies indicate that loneliness can be as harmful as smoking. At 77, my mother decided to join her neighborhood choir. Although she had her doubts at first, singing with new companions, rehearsing for performances, and sharing joyful moments brought back her energy and enthusiasm. "When I sing, I feel like my heart is filled with new life," she says. We laugh, sometimes make mistakes, but we learn together and share happy moments. In that smile, I saw my mother come alive again. Reflecting on all these experiences, I realized that healthcare after 70 should not focus solely on disease prevention. It's essential to adopt a holistic approach that addresses not only physical well-being, but also emotional health and social connections. A clear example of this was the wellness program at a senior living facility I had the chance to visit recently. There, the coordinator explained that every morning upon waking, the residents kept a journal to record how they felt emotionally, their energy level, any physical discomfort, and the quality of their previous night's sleep. This practice helped them become more attentive to their own body signals and not ignore even the most subtle changes. I also applied this method with my parents. At first, my father mocked it a bit, saying he was no longer a student to be writing in journals. But after a few weeks, he was the one reaching for the pen first. "Now I understand what kind of days affect my sleep," he said. It was all the coffee's fault. By understanding his body better and connecting his physical state to his daily habits, my father began to take his health much more seriously. In old age, more than at any other stage of life, small, consistent actions hold great value. Whether it's doing a bit of exercise, enjoying a cup of tea, or writing a simple sentence in a journal. Every time I stayed up late watching TV or drank caffeinated beverages, I would end up struggling to fall asleep. After several nights of poor rest, I finally started paying attention to the subtle signals my body was sending me. Curiously, those subtle sensations often told me more than an expensive medical test. I experienced firsthand how crucial it is to make a habit of paying attention to both physical and mental well-being. And it's not just about the body. Emotional health also needs care. In such a hectic and complex world, learning to manage stress has become a key factor in maintaining good health. A family friend began practicing meditation at the age of 76. At first, she found it extremely difficult to sit still in silence with her eyes closed. Even 5 minutes felt endless. My thoughts wouldn't stop racing. I couldn't concentrate at all, she said. However, she now dedicates 20 minutes each day to meditation. After calming her mind, she also noticed that her body became more balanced and her blood pressure improved significantly. During that special period, she found inner peace and physical balance thanks to her mental tranquility. Prevention is equally essential. Even if someone feels healthy, danger can appear without warning. It's crucial to begin with a thorough home review to prevent falls. Ensure proper vaccinations for flu, pneumonia, and shingles, and also pay attention to dental care. All of this contributes to a safer and more comfortable life in old age. At home, we installed non-slip mats in the bathroom and sturdy grab bars on the walls for my parents. We also replaced the light bulbs with ones that were softer and brighter. From experience, I can confirm that these small adjustments can prevent major accidents. And most importantly, one of the pillars of a long life is having a sense of purpose. It's not just about breathing and making it through each day, but about being clear on why we live. The long-lived elders of Okinawa, Japan, almost all had their ikigai, a reason that gave their lives meaning. My mother also discovered her purpose. At 73, she started volunteering at the local elementary school, reading stories to the children. That activity gave her renewed energy. I feel happy when the children respond to my stories. I feel like I'm still useful to someone, she said. In those words, I saw a pride and satisfaction that's hard to fully describe. Perhaps an activity like that brings more vitality than any health supplement. So, what central lesson can we draw from this long story we've shared today? It's not that medical checkups become irrelevant as we age, but rather that their purpose changes in an essential way. When we were younger, the key was to detect illnesses early and treat them quickly. In the second half of life, what truly matters is not the number of years we live, but the quality of our existence. A clear example of this is the story of my friend, Professor Yun. At 88, during a colonoscopy, doctors found an anomaly and suggested surgery. However, after thinking carefully about his situation and what was most important to him, he chose to focus on managing symptoms rather than undergoing the operation. I don't want to spend the time I have left in a hospital bed. I'd rather make the most of what I can still do now, instead of going through a long recovery process, she said. At first, her choice deeply surprised me. However, as the months went by, I began to understand her perspective. In the 2 years that followed, she managed her illness effectively, enjoyed more time with her grandchildren, and fulfilled her lifelong dream, visiting Jeju Island. Instead of choosing painful treatments, she was able to close the final chapter of her life in an exceptional and unique way. In the end, she taught us through her example that the true meaning of health isn't just about prolonging life, but about preserving the energy to continue doing the things we're passionate about. My mother puts it this way: to me, health is having the vitality to hug my grandchildren, the joy of tending my garden, and the peace of enjoying a conversation with lifelong friends over a cup of coffee. In those few words, she summed up both her passion for life and the real concept of health. That's right. Isn't that precisely the kind of health we should strive for? I hope this story has left a new vision in your hearts. Beyond spending time, money, and energy on unnecessary tests or treatments, I hope you find the wisdom to focus on what truly matters in your lives today. Have you ever looked at yourself in the mirror in the morning and noticed more dark spots appearing on your face? Have you felt uncomfortable showing your hands because of those brown marks on the backs? Has something like this happened to you? Do you feel frustrated? I completely understand. My name is Carl Yang. I am a dermatologist, and I have been practicing this profession for over 50 years. Throughout my career, I have treated tens of thousands of patients. Today, I want to give you an important promise. Don't give up. It will only take you 3 minutes to get rid of what many call the fungi from beyond, also known as seborrheic keratosis. I fully understand how you feel when you look in the mirror and see those dark spots that make you sigh. You have fought hard. I know how much you tried to remove them, from pharmacy depigmenting creams to expensive products and even home remedies like lemon juice. But it didn't work, right? You just ended up spending money and feeling even more frustrated. But that ends today. You only need to pay attention for 3 minutes. One of my patients, Mrs. Carly Yen, managed to reduce her seborrheic keratosis of more than 20 years by half in just 3 weeks using this method. And the best part, she did it without going to the hospital, only from the comfort of her home. Before, she felt uncomfortable going out and preferred to stay inside, but now she enjoys walks with her friends and feels much more fulfilled. Seborrheic keratosis is a condition that develops due to an excess of melanin in the skin. In medical terms, it is known as seborrhea. If left untreated, the spots can grow larger and become darker, which makes even laser treatment less effective over time. This condition is especially common in people who have worked outdoors for long periods or have been constantly exposed to the sun. When we were younger, we usually didn't worry about protecting our skin from the sun, right? Now, that exposure shows up in these marks. They usually begin to appear around the age of 40. At first, they are tiny, but over time they grow and darken. Sometimes they appear as small clusters of light spots, like scattered dust. Other times, as large spots the size of a coin. These spots mainly appear on the face, hands, arms, neck, and chest, areas most exposed to the sun. One of my patients, Mrs. Penny Smith, had so many spots on her face that she became depressed. She even felt ashamed to take photos at her granddaughter's wedding. However, with the treatment I recommended, she started to see improvements in just 3 days. 1 month later, she was comfortable taking photos. Today, she keeps that picture in her wallet and proudly shows it to everyone. You might also look 10 years younger. Also, excessive spots may indicate that your liver function is not at its best, which could raise concerns about your overall health. From what I've observed, people with liver or digestive problems tend to have more keratosis. For this reason, treating the spots is not just a matter of appearance, but also a health concern. In dermatology consultations, removing one spot can cost between $50 and $100. If you have 10 on your face, the total would be between $500 and $1,000. And one session is not enough. Usually 3 to 5 treatments are needed. Therefore, the total cost could range from $1,500 to $5,000. With our pension, that is a big financial burden. If you watch this video until the end, you can avoid spending all that money. Don't keep wasting your money on clinics. Today, I'm going to show you the most effective method to eliminate seborrheic keratosis, which I discovered after 50 years of experience. This method is so easy to follow that anyone can do it. It doesn't require a lot of money, and you can use ingredients you already have at home. The first trick is a honey and lemon mask. My patient, Mrs. Kim Oksoon, managed to reduce her keratosis by half in just 3 weeks using this treatment. Even I, as a dermatologist, was surprised. She used to cover her face with a large hat because of the spots, but now she feels confident going out. Why are lemon and honey so effective? Lemon contains vitamin C and citric acid, which help eliminate the melanin accumulated in the spots. Honey acts as a natural moisturizer, preventing the skin from drying out. It also has antibacterial properties, which help keep the skin in good condition. Preparing a lemon and honey mask is very simple. Squeeze half a lemon to get the juice. Combine it with a tablespoon of honey. Add a bit of flour until you get a paste. Apply this mixture on the dark spots, seborrheic keratosis, and leave it on for 15 minutes. Then rinse with warm water. That's how easy it is. It's not necessary to do it daily. 2 or 3 times a week is enough. Here's a small tip. It's best to use fresh lemons. The ones you just bought are much more effective than those that have been stored in the refrigerator for a long time. Make sure to use pure honey without added sugar. Local honey you find in markets or neighborhood stores is the most recommended option. This way, the benefits multiply. When you apply it for the first time, you might feel a slight burning sensation. This is completely normal. Don't worry. However, if it burns too much, rinse immediately and drink plenty of water. Next time, try using a little less lemon juice. There is something crucial you must remember. After applying lemon on your skin, it is essential to use sunscreen. If you don't, the spots could worsen. If possible, do this treatment at night, and don't forget to put on sunscreen the next day before going out. Don't miss this. At first, Grandpa Lester Thompson was not convinced this could work. He thought something so simple wouldn't have an effect. However, on the 3rd day, he started to notice some improvements, and after 2 months, the spots on his skin had significantly decreased. Now, he loves taking pictures with his grandson. Before, he avoided cameras, but lately, he even takes selfies with him. The second trick is a mung bean green bean mask, a recipe passed down from my grandmother. Since ancient times, mung beans have been known for their beauty benefits. They contain a substance called saponin, which helps remove impurities from the skin and lighten it. My mother used this treatment and reached the age of 85 without any imperfections on her skin. All the women in the neighborhood admired her for it. Preparing it is very simple. You only need 3 tablespoons of mung bean powder, 2 tablespoons of milk, and 1 tablespoon of honey. Mix well until you form a thick paste and apply it over the spots. After 15 minutes, rinse with water. That's it. It is recommended to apply it 2 or 3 times a week. A useful tip: if you can't find mung bean powder, you can easily get it at pharmacies or supermarkets. It is often available even in local stores. Its price is around $5,000 per package, so it's not expensive. Another option is to buy the beans and grind them yourself in a blender to get fresher powder. If you slightly warm the milk before adding the powder, it will dissolve more effectively. And the most important thing, perseverance. Don't get frustrated if you don't notice any differences in the first few days. Those spots didn't appear overnight, so making them disappear will also require patience. If you apply these remedies 3 times a week regularly, you'll start to see visible results within a month. You'll be amazed at how your skin looks increasingly different when you look in the mirror. Before we continue, remember to like if you're enjoying the video, and subscribe to the channel to get the best tips on how to attract abundance and prosperity into your life. Let's keep going. Now, I'm going to reveal the third secret, and this one really is unique. You can get rid of spots using a very common fruit that you probably already have at home. It's a homemade solution that involves no extra cost, so don't ignore it. This third tip, which I confidently recommend, is to massage your skin with banana peel. After 5 decades of experience, I can say it's the most effective remedy I've ever tried. Why exactly banana? Because the inner side of its peel, that white part, is full of vitamins A, B, C, and E, which help reduce the pigmentation of spots. It also contains citric acid and salicylic acid, components that gently help remove dead skin cells. The method is quite simple. Take a banana, enjoy its taste, and keep the peel. Use the white inside part to gently rub the spots in circular motions for about 10 minutes. Avoid applying too much pressure. Let it sit for another 15 minutes. And finally, rinse with water. That's all. Do this every night after washing your face. One of my patients, Mr. Bob Johnson, a rather skeptical grandfather, doubted it a lot at first. How could he have imagined that a simple banana peel would lighten his spots? However, his daughter convinced him to try it, and in just 3 weeks, he noticed a clear improvement in his skin's appearance. Since then, he has made it part of his daily routine. He eats a banana and uses the peel to massage while watching TV, with no effort at all. The white part inside the banana peel contains a large amount of vitamins and citric acid, making it a natural ally to fade skin spots. Wanting to share a secret? Bananas work better when they're not fully ripe. It's best if their peel shows some dark spots. If they're very green, they're affected creases. And if they're overripe and brown, they're not as beneficial either. One more tip, use the banana peel only once. If you reuse it, it won't work the same. Also, it's important to rinse your skin well with water afterward. Otherwise, it might feel sticky. The best part? This trick costs nothing. You're using something you would normally throw away. Just eat a banana a day to give your skin excellent care. It's a fruit full of beneficial properties, ideal for overall wellness, helps regulate intestinal transit, and even helps reduce seborrheic keratosis, also known as dry warts. It's like getting 3 benefits in one. Grandma Charlie Wong almost completely reduced the warts on the backs of her hands in just 3 weeks using this method. Her grandchildren praised her, saying her hands looked beautiful. Can you imagine how happy she felt? She said she no longer feels uncomfortable holding hands with her grandchildren in public. Think about that. You can achieve it too. I'm going to reveal another valuable secret. If after massaging your skin with a banana peel you apply a small amount of olive oil, the result is enhanced. This oil helps the beneficial nutrients from the banana penetrate the skin more effectively. It's a technique we don't even share in my medical practice. I discovered it throughout my 5 decades of professional experience. What if you're allergic to bananas? Don't worry. You can achieve a similar result using pineapple peel. The inside of this peel contains enzymes that can be very useful for treating keratosis. However, be careful, as pineapple is highly acidic and could cause irritation on sensitive skin. Start by applying it for only 5 minutes. Now I want to talk to you about the fundamentals of caring for keratosis, keeping the skin well hydrated and protecting it from sun exposure. This is where many people often make mistakes. If you don't know this, everything you have learned so far will be worthless. That's why I asked you to follow me until the end. Now I will talk about something even more crucial than eliminating keratosis: how to prevent it from appearing. This is the most important thing. Even if it means fewer people need medical attention, which could be a disadvantage for me, your well-being is a priority, so I will share all the information with you. Throughout my 50 years of treating thousands of patients, I made a surprising discovery. Those who did not have any keratosis shared a common habit: regularly consuming certain foods. Today, I will share that discovery with you. The first food is spinach. What makes it so beneficial? Its high iron content, as well as vitamins A and C, which help prevent the excessive production of melanin in the skin. Additionally, it has a large amount of chlorophyll, which strengthens the skin cells. Eat spinach like this, about 3 times a week, lightly cooked. Avoid boiling it too much, as it would lose its benefits. Simply place it in hot water for 30 seconds. Add a tablespoon of olive oil to improve nutrient absorption. If you add a touch of salt and sesame, you will also enhance its flavor. Grandma Carly Ming used to eat a small handful of raw spinach every day, and in just 3 months, her warts were reduced by half. Now, as part of her daily routine, she chews a few leaves each morning. She has even started teaching her neighbors how to grow spinach, since it can be easily grown on a balcony. We encourage you to try it. The next food is the carrot. Carrots are rich in a compound called beta-carotene. This beta-carotene converts into vitamin A inside the body, and this vitamin is very effective at preventing sunspots, also known as age spots. Beta-carotene, especially, acts as a natural sunscreen that protects the skin from damage caused by ultraviolet rays. To take advantage of its benefits, consume 1 small carrot a day. You can accompany it with a little oil, which helps the body absorb its nutrients better. Another option is to enjoy it as juice. If you add half an apple, not only will the flavor improve, but its effects will be enhanced as well. A little tip: it's best to eat the carrot with its skin on, since the most beneficial nutrients are just beneath it. Wash them carefully and consume them with the skin. Nowadays, there are many organic carrots available, so you don't have to worry. My wife has been drinking carrot juice every day for 20 years, and at 75 years old, she practically has no skin spots. All her friends, who have many spots, always ask her what her secret is. She usually says she's a little embarrassed to share it, since it's something very simple. The third food is the walnut. Walnuts are rich in omega-3 and vitamin E, elements that help reduce inflammation in the skin and strengthen the cell membrane. When inflammation decreases, less melanin is produced. Additionally, walnuts are full of antioxidants, which help slow down skin aging. To consume them, it is recommended to eat 5 to 6 walnuts a day, preferably in the morning, as the body assimilates them better then. If eaten excessively, they can cause weight gain due to their high calorie content. So moderation is important. You can also crush them and mix them with yogurt. I personally eat 5 walnuts every morning before breakfast, accompanied by a glass of water. Mrs. Lindsay Jack incorporated walnuts into her diet regularly for 6 months, and when she visited the hospital, her sunspots had diminished so much that she no longer needed treatment. At first, she was hesitant because walnuts seemed expensive, but then she realized that with the price of 1 purchase, she could have walnuts for 2 months, considering it an economic investment. I still remember the look of satisfaction on her face. Here's a unique secret. If you incorporate a little of these 3 foods into your daily diet, you will prevent melanin production from within the skin. That way, even if you are exposed to the sun, it's unlikely that spots will appear. In fact, some studies show that the effect triples if you consume carrots and walnuts together. There are also other foods that help prevent spots, such as tomatoes, blueberries, salmon, and green tea. However, the 3 foods I mentioned are the most powerful. Now I want to talk to you about the key aspects of treating sunspots, skin hydration, and sun protection. This is where many people make mistakes. If you don't understand this, everything you have learned so far will be useless. So make sure you pay attention until the end. Even if you know everything I've explained before, if you omit this, it won't have any effect. This is the most crucial secret I have discovered in my 50 years as a dermatologist. Keep the skin well hydrated and protected from sun. It is essential, and I will say it 3 times. Hydration, 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 and sun protection, sun protection, sun protection. Why is it so crucial to keep the skin hydrated? Because as the years go by, our skin tends to become drier. When the skin is dry, it cracks, and through those cracks, substances can penetrate that stimulate melanin production. That's why if you keep your skin well hydrated, you can prevent spots from appearing. To keep your skin hydrated, follow these steps. After washing your face at night, immediately apply a moisturizer. Don't delay. Gently pat your face dry with a towel and apply the cream while your skin is still slightly damp. This helps lock in moisture and keeps your skin hydrated for longer. You don't need expensive products. A few drops of olive oil will be enough. Put a few drops in the palm of your hand and spread it over your skin, especially focusing on areas with dark spots. Apply a mask twice a week. Mix 1 tablespoon of honey with half a tablespoon of olive oil. Spread it over your face and remove it after 20 minutes. This is the advice I've given my patients for the past 50 years. Use moisturizer within the first 3 minutes after showering or washing your face. I call it the golden 3-minute window. If more than 3 minutes pass, your skin begins to lose moisture. And once that happens, not even the best product will be fully effective. My mother always kept her cream in the bathroom and applied it immediately after washing her face. For that reason, even though she was over 90 years old, her skin had virtually no blemishes. Another small trick. Before going to bed, apply a thick layer of petroleum jelly to the affected areas. Since petroleum jelly has a sticky texture, it can leave marks on your pillow, so it's best to place a towel over it. However, the results are impressive. Try it for a week and you'll see the difference. Grandma Jennifer Lee applied banana masks and moisturized consistently for a month, and the spots she had for 20 years almost disappeared. Her family asked if she had undergone cosmetic treatments. She continues using a honey and petroleum jelly mask every night and says that, despite being 78, her skin looks like that of a 60-year-old woman. Now, let's talk about sun protection. The main enemy of skin spots is ultraviolet radiation. When UV rays touch your skin, it produces melanin as a defense. That's how dark spots appear. Here's how to protect yourself from the sun. Sunscreen is essential. Choose one with SPF 30 or higher. The proper amount is about the size of a 501 coin. Apply it even if the sky is overcast, since UV rays can penetrate clouds. Reapply every 2 to 3 hours. It's especially important to reapply at midday when UV radiation is at its strongest. Also, consider using hats or umbrellas for extra protection. Many people make this common mistake. Skipping sunscreen when it's cloudy, rainy, or cold. Big mistake. UV rays can penetrate clouds and glass and are present even during winter. That's why applying sunscreen daily is crucial, no matter the season or weather. A key tip: don't forget to protect the backs of your hands. After the face, they're one of the first areas to show signs of aging. Some people have flawless faces, but their hands reveal their age due to numerous spots. Don't neglect hand care. My mother lived in 93, and no matter the weather, she never skipped her daily sunscreen. Even on the day she passed away, she had hardly any sunspots. While her friends had visibly spotted skin, hers remained in excellent condition. She always said, "Sunscreen isn't medicine, it's like rice," meaning it should be used every single day without exception. Let me tell you another special method. If you apply vitamin C between your moisturizer and sunscreen, the effect of fading sunspots is doubled. Vitamin C helps break down melanin. Even the more affordable versions you find at the pharmacy work perfectly. There's no need to buy expensive ones. In this case, order matters. First, after washing your face, apply the moisturizer. Second, apply the vitamin C. Third, apply the sunscreen. It's essential to follow this order because switching it significantly reduces its effectiveness. I remember a patient who had very pronounced sunspots. She went through several laser treatments with no visible improvement. However, after consistently adopting this hydration and sun protection routine for 3 months, her spots began to fade noticeably. To this day, every time she comes to my office, she expresses her gratitude. Now I'm going to share a special technique that not only fights sunspots, but also supports brain health. It's a truly amazing method. It doesn't just focus on skincare, it also holds a key to aging healthily. So stay with me until the end. This last secret goes beyond appearance. It also protects mental well-being. It involves doing hand exercises. Did you know that keeping your hands in good condition helps maintain both your mind and your skin? Throughout my 5 decades of medical practice, I reached a fascinating conclusion. People who frequently use their hands have fewer sunspots and a significantly lower risk of developing dementia. Why? Because the fingertips are full of nerve endings that directly activate the brain. In fact, fingertips have a higher concentration of sensory nerves than any other part of the body, and these connect directly to the brain. A patient I treated, Mr. Kong Young-ho, aged 86, dedicated half an hour a day to finger exercises and, surprisingly, retained a memory as sharp as someone much younger. Medical evaluations showed that his brain had the characteristics of a 60-year-old, something truly remarkable from a clinical standpoint. And even more surprising, he barely had any sun-induced spots on his skin. These finger movements improve blood circulation, which also positively affects skin appearance. Try this simple exercise. Touch your thumb to each of the other fingers one by one. Start with the index finger, then the middle finger, then the ring finger, and finally the pinky. Do it slowly at first and gradually increase the speed. Repeat the sequence 10 times. Then, rub your palms together until they feel warm. Next, place them over your face. This gesture stimulates circulation in the facial skin and gives it a brighter appearance. If you apply light pressure on areas with dark spots, the effect is even more noticeable. Finally, interlace your fingers as if locking a padlock and make wide circular movements with your wrists 10 times clockwise, then 10 times counterclockwise. This movement also promotes blood flow in the wrists and arms. Spend 5 minutes in the morning and 5 at night on these hand routines. You can do them while watching TV, before meals, or just before going to bed. The key is to incorporate them as a daily habit. An extra tip: after doing the exercises, rinse your hands with warm water and apply a moisturizing cream. This can help fade the dark spots on the backs of your hands, which are often exposed to the sun. If you also apply sunscreen after the exercise, the results will be even more effective. One of my patients, Mr. Clark Chung, followed this routine for 3 months, and the dark spots on the backs of his hands were significantly reduced. Moreover, his memory improved noticeably, to the point where he no longer forgot to take his medications. Now, the first thing he does each day is hand exercises. An additional benefit of these practices is that they also help prevent arthritis in the fingers. Over time, it's common for fingers to become stiffer and more painful, isn't it? If you do this exercise regularly, you'll notice your joints becoming more flexible and the pain decreasing. My mother also practiced it and was able to continue sewing on her own until the age of 90. An interesting fact is that frequent finger movement boosts our mental capacity. This happens because moving the fingers directly stimulates the brain. That's why, if we develop a habit of using our hands regularly from a young age, it will greatly help in avoiding memory problems in the future. I begin every day by doing this hand exercise. Now that I'm 75 years old, my memory is still excellent, and I hardly have any warts on my hands. My fellow doctors often ask me what my secret is, and the answer is this hand exercise. Now, to wrap up, I'll summarize the methods I've shared with you. First, treat hand warts with a lemon and honey mask, a green bean mask, and banana peel. Second, include spinach, carrots, and walnuts in your diet regularly. Third, make sure to keep your hands well hydrated and protected from sun exposure. Fourth, promote brain health by doing hand exercises. If you remember and consistently apply these 4 recommendations, you will notice an improvement in your hand warts within just 1 month. Plus, you'll enjoy a much fuller and more active old age. Dear friends, today I want to share everything I've learned over the past 50 years. These are insights I don't even mention at the hospital because they're so simple that they don't require medical intervention. However, I decided to share them today because I believe your well-being is what matters most. In the next video, I'll show you an excellent method to relieve joint pain. It's a very effective technique for treating knee and back pain. I will pass on to you all the knowledge I've gathered over 50 years in the medical field, with the goal of helping you enjoy a full and healthy old age. Thank you very much.